Tonight in Medical Rounds, going to the doctor is a lot more than just getting a checkup these days. Physicians at Hartford Healthcare are actually monitoring your physical activity. Dale Bond is the Director of Research Integration at Hartford Healthcare, and he is joining us right now to talk more about this. Dale, thank you very much for being here. We appreciate your time.
Thank you for having me.
I understand the program here is called Exercise in Medicine. What is this? How did it come about?
So this is a global health initiative, and it was launched in 2007 jointly by the American College of Sports Medicine and the American Medical Association. And what they wanted to do was endorse physical activity to be a vital sign, just like heart rate or blood pressure in all clinical settings. And what it's designed to do is to assess and compare patients' physical activity level to national guidelines.
How are you tracking that, the physical activity of patients?
We're using a validated measure that was developed by this organization called the Physical Activity Vital Sign, or PAVS. And it's 2 questions, and it can be administered in less than a minute. And the first question asks patients, how many days on average per week do they engage in moderate to vigorous intensity exercise, like a brisk walk? And the second question asks, how many minutes per day do they perform exercise at this level? These 2 values are then multiplied to calculate total weekly minutes of moderate to vigorous intensity exercise.
I'm curious, what are the national, physical activity health guidelines that you're talking about?
For substantial health benefits, the CDC and the U.S. Department of Health and Human Services suggest that all of us should do at least 150 to 300 minutes a week of moderate intensity aerobic physical activity, or 75 to 150 minutes a week of vigorous intensity aerobic physical activity, or an equivalent combination of both. We should also do muscle strengthening activities of moderate or greater intensity at least 2 times per week.
I would imagine this goes without saying, but this is very important for a patient's overall health, right?
Definitely. So we know that inadequate physical activity is a cause of premature mortality, increases risk for several chronic diseases, relates to worse COVID-19 outcomes. And it also has a huge impact, economic impact on our healthcare systems, approximately $120 billion per year. And so it's very important to integrate this as a vital sign tool into our electronic medical record. And so when we do this at every clinical encounter, we can quickly alert providers if inadequate physical activity to prompt appropriate counseling or referral.
Very interesting. Dale Bond, thank you very much for joining us from Hartford Healthcare. We appreciate your time. Sounds like a fascinating program. For more information on the program, you can go to this website right here, hartfordhealthcare.org.